guys, welcome to the first lecture of the Connecting the Young World Fair. I am really glad to present and introduce about Tolullah Oni, that's the first plenary speaker. She will speak about science as a global good, young scientists as a driver of urgence and agency beyond boundaries. She is an urban epidemiologist at the Medical Research Council Epidemiology Unit at the University of Cambridge. She is a Next Einstein Forum Fellow and the World Economic Forum Young Global Leader. Oni worked in South Africa, where she established an interdisciplinary program research initiative for cities, health, and equality at University of Cape Town in 2007. She worked as a registrar in the Western Cape Department of Health. She became interested in investigation that can manage chronic infections and non-communicable diseases. Oni was made a senior lecturer at the University of Cape Town. Here, she developed the University of Cape Town first undergraduate degree in global health, with launched in 2014. The course created by Oni is one of the first to teach global health from the perspective of the global south. She moved to University of Cambridge, where she joined the Medical Research Council Epidemiology Unit as a senior research fellow. She is a member of the Global Diet and Activity Research Group and Network, which works to prevent non-communicable disease in low-income countries. You're welcome, Tolullah. Thank you so much.
Thank you. Thank you for that kind introduction. It would be great to, seeing as we've got a nice cozy group, it would be great to know who is in the room. So do feel free to just introduce yourself in the chat. I'd love to know where you are dialing in from. So what countries are you dialing in from? Because it'll help in the conversation. So what I'd like to do is just make this as conversational as possible, actually. So if you have a question on something I say along the way, just type into the chat and I will try to, I'll try to pick it up as I go, or just unmute yourself and interrupt. Let's make it as similar to the, to being in a small room in real life as possible. So I'm not just talking to myself. Do we have anyone from, let's go continent-wise. Brazil, okay, we have Brazil. Anyone else from that region? Anyone else from Latin America or the Caribbean? Welcome, Clara. Mexico, awesome. Anyone else in that region? Brazil also, oh, Brazil is looking strong. What about UK? Cool, you're just next to me. Happy lockdown. Have we got anyone from Asia, in the Asian region? What time is it? Is this time? This is not a very good time for Asia, is it? Or from North America? Don't be shy. Okay, which other regions is not? Who hasn't said where they're from? Raphael, where are you hanging out from? Zimbabwe, yay. Anyone else from the African region? So is everyone else Brazil? Is Brazil just like hyper representing today? That's awesome. Also Brazil. Okay, it looks like Brazil is winning so far. So I'm going to give you a bit of a walkthrough. Let me just share my slides. with you. So what I'll do is I'll tell you a little bit about how I've got to where I am now, the kind of pathways that got me there, and I'll use the kind of research I do to illustrate that, and then I'll focus on something that we're working on very actively at the moment. It's on the fore of everyone's minds. Those of you who were at the Youth Science Forum last year may have seen some of my slides, but I don't, yeah, okay, good. So this is where it started really. So as we go along, if you just watch the arrow at the top, because one of the things when I was at your stage, by the way, that's the other thing I should find out. What are you? Are you at school or university? Type it in the chat so I have a sense of where you are. Because when I was finishing school and starting university, so I studied medicine, I saw people who were doing really interesting things. And whenever you ask them, well, how did you get there? I was always so frustrated because they always had some long-winded story, right? It wasn't like study this, do this, and get there. It was like, oh, I was just walking along, and then I met this person, and then they introduced me to this, and I did that, and I'm like, well, how can I copy that? So it's really helpful to just kind of show some of the ways and some of the key paths that have led me here, and it's never linear. This looks like a linear line. So it all started really with my interest in global health. So, which sometime during medical school, I was in studying international health. I took a year out and was doing a Bachelor of Science in International Health. And that was the first time it just blew my mind. I thought, wow, there is just a whole world of factors that influence health beyond what we've been taught in medicine, that there was just this global factors that influence health that I just wanted to know more about. So I ended up going in my final year university to French Guiana. Let's see. Juliana, have you been to French Guiana in Brazil? Is anyone in the north of Brazil? Brazil is the closest.
I've never been there.
No? Okay. Well, this is what French is, because that's your neighbor, right?
Yes.
Yes. So I ended up in French Guiana. It's a very funny story because I just wanted to go somewhere to practice my French because I thought that was an important part of global health. And I didn't want to just go to France because that was just not exciting enough. So I literally just Googled French speaking countries. and then I'd never heard of French Guiana before. So I thought, oh, this is interesting. So then I Googled French Guiana health problems. And then I found that they have this huge HTLV. It's one of the endemic HTLV. So HTLV is a retrovirus like HIV. And when HIV was first discovered, they actually thought it was HTLV3, but it turned out to be a different virus. So I thought, I don't know this country. I don't know this virus. This is definitely somewhere I want to go. So I ended up then Googling French Guiana HTLV scientists. And I found this institute, the Pasteur Institute in French Guiana, that was doing this research. I went on their website and I strolled until I found somebody's email address. And then I sent them an email saying, hi, I'm a medical student and I'd like to come do some research for 3 months in my elective. And he responded. And it was this PhD student who responded to say, yeah, come, we'll help you. So anyway, I ended up in French Guiana for 3 months. And there was in this village in the middle of the Amazon. So this is the health center that we're working in. I was working in for 3 months. This is the canoe that we take between the two villages, like to get to the clinics. And this was a jaguar I saw on one of the trips this is not zoomed in. It was quite frightening. but it was really interesting because that was my first experience of research, because I had to design the research myself, and actually ended up being my first publication, because I wrote about it afterwards. And that was really that's how I got really interested in research, really. So looking at the top here, so it started off with global health interest and an evidence policy. And you added a sprinkling of serendipity, because I didn't plan this and it just happened. So, but at the same time, I did things to try to make it happen. So if I couldn't predict that I would have ended up there, but in a way, they're probably different places I could have ended up. And so the opportunities that arise when you embrace serendipity is something that I want to highlight here. So speaking of serendipity, when I got back from this publication, I submitted it for a prize and I won a prize. Like I was talking to the people at the London Youth Science Forum last year, who obviously a lot of people won prizes to get there. And it's really interesting. You know, it's not just a once-off thing, because you never know what happens from that one prize. So I won the prize for this paper, and I was from the Royal Society of Tropical Medicine. And then I was speaking to the president. He says, you know, what do you want to do? And I was like, well, because at that time I was already a first-year medical student, first-year doctor. And I said, well, you know, I'm going to Australia to work for a while in accident emergency, but when I come back, I'd quite like to do some research. So he says, oh, call me when you get back. I know somebody doing research in Cape Town. I'm like, I've never been to Cape Town, so I will call you. So I called him when I got back. At the time I was working in London and doing HIV, and he put me in touch with somebody in Cape Town, and I ended up in Cape Town. But I actually ended up doing a different job, because it took me a while to get registered to practice. And I met this guy on a ward round. So I was just attending, because I couldn't practice yet. I was just attending ward rounds just to learn about the health system in the country. And I needed a lift. I didn't have a car. And someone said, oh, this guy's going to town and he has a lift and he has a car. So I went to speak to him. I said, can I have a lift? And he's like, oh, are you from the UK? What are you doing here? And then we got chatting. And by the end of it, he was like, oh, we're actually just about to apply for a job. I think you should apply. Like that, right? So and then he gave me a lift, and then on the way back, like a 20-minute ride, he was like, what are you doing next year? And I'm like, I think I'm only here for a year. It's like, well, if you stay for 2 years, you can do a master's. They have a really good master's here, but also I'm at Imperial College in London, so you could do a PhD there. And I got out and I was like, I guess I'm here for 5 years. Like, that wasn't the plan, but okay. So I ended up working for him for 7 years, it turns out. He became my PhD supervisor. And so again, that serendipity and the atypical opportunities, and really embracing, because I could have said, oh, you know, but I'm only here for a year. It's like, what are you going to go do? It's like, well, I don't know, but I said I was going to be here for a year. And he was like, oh, I'm offering you this opportunity. You don't know where it's going to go. So, but what have you got to lose? And that really set me up undoubtedly for everything else that was to come, because we ended up doing, so my PhD was on the epidemiology of tuberculosis and HIV co-infection. He was an immunology group, which I didn't think I was interested in, and actually it turns out I wasn't interested in, but I tried it. But through that, because I was doing a master's at the same time in public health and epidemiology, so I started getting training in epidemiology. So even though we were doing immunology, and I did end up doing some immunology for my PhD, I ended up learning about epidemiology, and he really gave me the space in the group to develop my ideas around epidemiology, even though that wasn't the focus of his unit. And in that process, I started getting interested in complexity. So that's kind of the next path, the next thing that layered on, because I noticed that, you know, we have this co-infection. So we, you know, medicine, we often think about diseases as one disease or one disease or one disease, and the health system is set up that way. You're a TB doctor, or you're HIV doctor, or you're diabetes doctor, or you're, you know, whereas in reality, they tend to not just coexist, but they actually interact. So part of what I was looking at here was how TB and HIV interact. I also realized that I started seeing, because I was seeing patients at the same time as doing the research, and I started noticing that the patients I saw that had HIV and that had TB, that's not all they had, right? Even though that was the only thing that was supposed to, you look at it and like, oh, do you also have high blood pressure? Oh, am I not supposed to ask you about that because that appointment is for in a different place for a different day? Oh, and do you also have diabetes? Why am I not? So I started getting interested in the complexity and the fact that human beings are more complex, right? So the patient doesn't get the memos like, pick one of the following diseases to have. That's not how it works. And one of the things I found that was fascinating was that there was an interaction between tuberculosis and diabetes, which I'd never thought about, because my training was like, we learn about infectious diseases and then we learn about non-communicable, non-infectious diseases as two different things. They're very different specialties. When I started realizing that actually we've known for over 100 years, we've known that diabetes increases the risk of TB. But we've never done, but we've not set things up, partly because, 100 years ago, the poor got TB and the rich got diabetes. And so they were in different populations. Whereas actually what we're seeing at the moment is that, and this is happening across the globe, people that are higher at risk of the increasing prevalence of like obesity and type 2 diabetes and high blood pressure, it's happening particularly amongst the poor, right? Because of the environments that people live in and the unhealthy environments that are more likely and more prevalent. So I started getting interested in this complexity. Okay, that was TB HIV. And then along the way is embracing being a misfit. So that's the next thing, right? Because imagine now I'm in this group, that's an immunology group. I'm doing public health and epidemiology. I'm looking at not just HIV TB, but I'm starting to think about diabetes. So, we have these monthly journal clubs where everybody has to present a paper, and then everyone discusses it. So everybody, when it was my turn to present, they think, oh God, what's she going to bring now? Because it's something completely random. And I realized that I had to, because I tried, when I said I did a bit of immunology, I tried to fit in, because I thought maybe I just haven't tried immunology. I tried it. I was like, this is not for me. So actually, I'm going to stay in this group. I'm going to not belong, but actually, I'm going to work it out. And I think it certainly really helped that the head of the group just let me do whatever. It was like, yeah, that's what she does. But being a misfit, I think, really helped be part of it. So rather than discourage me, like, but it sometimes affected their confidence, right? Because you're not sure whether it's like, if it was such a good idea, maybe there'll be other people doing it. Why am I thinking about this, right? And you start questioning yourself. It's like, how am I the first person to, then it must not be a good idea. You start doubting yourself. So in hindsight, I only say this now in hindsight, that not fitting in and being a misfit was actually part of that journey. So this is some of my misfit work, where I decided I wanted to look at understanding how much we actually, of that multimorbidity that we actually saw. So I did a study, I looked in one clinic, I looked at all the people that were receiving treatment for either diabetes, tuberculosis, HIV, or high blood pressure. And I did that by looking at the electronic prescription records, right? So you see, by looking at the types of medications that are prescribed, you can say, okay, this medication is for. So if it's antiretroviral, it's for HIV. There's certain antibiotics that are specifically for TB. So that's how we could kind of retrospectively identify diseases. So this is not everybody, these are just the people who are on treatment. And what I found was, even though the way that the health system was set up was that HIV and TB went together, when you looked at people with HIV, 1 in 5 of them had another condition. And most of that was not TB, it was hypertension, which was just, it shouldn't have been surprising because the prevalence of hypertension in the general population is high. But the way the health system was set up made it surprising, because I just thought, well, in the HIV clinic, we don't ask regularly about that. So actually, so many of our patients are have this comorbidity, but we're thinking in very siloed ways, rather than adapting to the reality. And what we started seeing, so South Africa has the largest HIV treatment program in the world, right? And it was doing really well, right? So we started seeing, very good control of HIV. And part of the reason I ended up in this space is because I started thinking, well, are we treating diseases or are we treating people? Because even though we started seeing people still dying early, but of strokes, because they had high blood pressure for a long time, but nobody checked, even though they were coming to the clinic every month, because we were just focused on the HIV. So, oh, great, your viral load is down, that's great. But then you die at age 40 of a stroke. Is that good enough? Is that good health service? So that's what kind of drove me to this complexity, like how do we actually treat people and improve health altogether, rather than focusing on a disease and patting ourselves on the back because we've done well with that one disease, right? Oh yeah, that was okay. And then this is really where I started pivoting, right? Which is the next step along the path of, so it was the misfit, after kind of, as part of still doubting myself, bringing in the kind of looking for atypical opportunities, kind of embracing complexity, I started wondering, okay, but do I need to actually commit to this and pivot? And the reason why it sounds obvious in hindsight, but at the time, I was getting good publications in HIV TB. People were like, when you look for grants, people look at what you've done, right? So then it's like, well, why are you trying to do something where you don't have any evidence that that you can do this? So it was, so even my boss then, my supervisor, who was very supportive, was like, well, you will be more successful immediately if you can continue what you're doing now, because you've got a good track record. But I was really convicted by just the need to treat people holistically in this way. And this was one of the things that convinced me. So when we looked at that same study I talked about before, where we looked at how hypertension, HIV, diabetes, and TB interacted, one of the things that we saw, because the other thing when you think about hypertension, diabetes, you think, oh, older people. But we saw that actually they obviously interact, because even at the young 18 to 35 age group, we're already seeing more hypertension and more diabetes in people with HIV than people without. And I thought, no, we can't just, so these are people who are in the clinic every month to get meds from a young age. And we're missing the fact that they have these multimorbidities and the opportunity to intervene. So that missed opportunity is what really drove that pivot. What follows after pivoting is a quick succession, or probably not that quick succession, of multiple failures, right? I tried and I tried and I tried, right? I applied for so many grants, people, honestly, and I just got like I got rejections from literally everywhere. People, feedback I got was, your PhD was HIV TB. Why are you trying to do non-communicable diseases when you're specialist in infectious diseases? I got, well, why are people not, why are you focusing on something else where there is no track record in your group? Like, I couldn't get any money to do this. And the only reason I was able to do this in the end was my supervisor. And so this is after my PhD. This is me trying to pivot, post-doc. My supervisor ended up having getting a large grant for the group. So I applied internally and I got funding internally because he knew what I was capable of. And he really, that opportunity gave me that leg up, because then I could show that it was able to do this. And so with that brazenness, I pivoted even more because it wasn't complex enough to combine infectious and non-communicable diseases, because I started thinking, well, given that we're seeing younger people, and given that a lot of these conditions are actually preventable, and that they, we end up here right at the healthcare system by the time they get disease, waiting for disease to occur. And I thought, well, can't we go outside of the healthcare system and actually understand the environments that people live and work and play, and how can we make those healthier so that people can actually to prevent people from getting disease in the first place. Because when you're sitting in the healthcare system, we often forget that there was nothing inevitable about this person weren't born with high blood pressure, they weren't born with diabetes, right? They developed it. And we forget that in the healthcare system because it's about how do we get you treatment early? It's like, yes, that's important, but we could have intervened 15 years ago. And especially in the context of resource constrained settings, like it's so expensive to treat disease, right? It's so much more cost effective to prevent. But there's all these challenges. So this driving patterns of disease and really the need to move upstream. This is my incredible drawing. I drew this myself, people. I'm very proud to say, of essentially showing that what I thought I was seeing is, if you imagine this is an ambulance. I know it's obvious, but I'm just going to spell it out. This is an ambulance, right? Waiting to cart people away after falling into a stream and almost drowning, right? So imagine you're in this pool on this beach, and you see someone drowning, and someone goes out and tries to rescue them. The ambulance takes them away. You see another person drowning, and we get better. We get more ambulances. We get more lifesavers. We get more barriers, but nobody's saying, well, who's pushing people into the water, right? Why are we getting so many people drowning? And can we? Yes, it's important to make sure that there are ambulances when there are people drowning, but can we also prevent people from drowning? And so I realized that there were aspects of the city, different environments of the city that were kind of pushing people off this cliff and actually putting them in a drowning position. And so my question was, how can we actually make the city protect them? This is what I realized we were seeing. So in the healthcare system, you're seeing this health profile of the need for health, or disease, really. But what we weren't dealing with was what was lying underneath. The food environment, the housing that people lived in, the social support, the work conditions, the built environment, all those aspects. And we know that over 80% of factors that influence healthcare, or influence health, lie outside of healthcare. 80%. Does it make sense then that when we talk about health, we just talk about healthcare? Actually, everyone working in this space is working in health, right? So we started thinking about, in the context, we're in an SDG era, we're now only 10 years to go, right? But how, one of the things that I've observed over the years, actually, the Sustainable Development Goals, will we achieve them or not? Time will tell. But one of the things that I think that they've really helped is to help people think about the cross-cutting factors that influence health and human development. So this is something by the WHO that really shows the ways in which SDG 3, which is around health and well-being, actually impacts and is impacted by all of the other 16 SDGs. So if you look at poverty, which is SDG 1, we know that if we don't prioritize health needs of the poor, we won't achieve good health and well-being. If you look at p.1, 11, health cities, inclusive urban planning and clean air, we're not going to achieve good health and well-being if we're polluting the air and if we're not making the cities inclusive. So this was really my guiding light of the pivot. So that's kind of where I've ended up, right? So that was just kind of giving you a little bit of, I didn't want to start, this was the first slide, but I didn't want to start here because sometimes it seems like when people start, they knew exactly what they wanted to. I had no idea I would end up here. And there was nothing linear about how I ended up here. And it was just a mix of, random cosmic events that led here. And so, but I do think that's an important thing to highlight. So looking for those opportunities that may not be exactly what you expect is so critical, because you don't know where your interest will take you. I'll come to it afterwards if I don't remind me, because the other aspects that I want to highlight is just the asking questions, right? so I've always thought science was interesting, but it gets so much more interesting after school. And part of the reason is because, in school, I liked it because there was a lot of learning and lots of, fascinating things, but it was still very much about what we knew and basically putting a framework to understand the world around us. Whereas beyond school, it really is about all the things we don't know. And actually, the exciting thing about science is all the things we don't know, and the approach of not, there's no answer, and it's about the questions and asking the question. The questions that you ask really drive the kind of science that you do. I don't think I put the slide here, so I'll give you an anecdote. I used to pre-pandemic travel a lot for work, and I'm a runner, right? And so part of the ways that I kind of keep healthy, but also see the places that I travel, because sometimes you go for a meeting, you stay for 2 days and you leave. And if you don't get outside, did you ever really go there if you just stayed in the hotel room or the conference center? So I run a lot. And across different cities that I run in, I realized that psychologically I was thinking, how easy is this city to run in, and how easy, because when we talk about, we need people to be more physically active, it's like, how supportive are the environments that they're going in? Is this just like fake news, right? So they say you have to be more physically active. It's like, well, but how? That's not a rational thing. And I started noticing, particularly, I used to do a lot of traveling in different cities in Africa. And I would get so many. So I remember I was running in Douala, it's in Cameroon. I don't know if anyone from Cameroon is here. And people were shouting like, bon courage, like good luck. And I thought, because it's so unusual. And I could see why, because I had to navigate, like the air was like, afterwards, I got a bit sick, I had to navigate all this like pollution from like the motorbikes, and there were so holes in the in the road. I also noticed, because I went on a really long run, you could tell when the neighborhood got richer by how much better the pavements were, right? So then the places where people who have the highest burden of disease have the environments that mean that they're unable to be physically active safely. Doesn't make sense, right? By comparison, I was running in Yaoundé, which is also another city in Cameroon, the same city. And it's okay, so it's a bit higher. And there's this kind of space, a public space that people can go in and you can safely run, and you can see people like in the morning running up and down. And I thought, well, this is so much more pleasant, right? This is the same city, but same country, but two different experiences. So I started asking, well, I wonder what the experiences of people who do physical activity, exercise in public spaces are, and what are the health risks they pose. So I wrote a research project on this, and I got funding to do it. So actually, based on my running, we're looking at this project in a couple of different cities, including Lagos, to find people who are running, who use public space, because that's the most equitable, because it's free for exercise, and to understand their experiences. We're measuring air quality to look at what air that they're breathing and understanding the injury risks. And so that's just an anecdote of how your lived experience, so also your science is not different from your lived experience, right? So it's not just science, it's like in class or in whatever, right? The world around you and your experience is what brings your brings the uniqueness to your science. And that's why it's important to see science as something that is just about the unknown, because the questions you ask will be different than the questions someone else asks because of your day-to-day lived experience. So that's just a side. Urbanization and health. This is where we are with urbanization, right? The most urbanized spaces are largely North America and Europe. But when we look at, and to some extent South America, but when we look at where countries are most rapidly urbanizing, we see that the big change over the next 30 years now is happening in Asia and Africa, right? Put a different way, this is This is a number of people moving into these cities per, per hour, right? Number of people moving, hourly growth, right? So in New York, we think about New York as big city, 11 people. London, 10 people. Where are we? Brazil, I didn't have a number. Rio, 13 people, right? Sao Paulo, 25. You move right up to over here, as reflected here. Beijing, 60 every hour, people. Like Delhi, 75, Lagos, 50. So the scale of growth is just phenomenal, right? Why is this important? Well, this is, you may have come across this triangle. I've adapted this. So we think about vectors and infectious disease transmission. We often think about the vector, the host, and the environment. So I've adapted it to think about different aspects of how urbanization influences health, and bringing in the planetary health context. And I don't know if you're familiar with the planetary health context, but it's essentially looking at that balance between human health and the ecosystems that we depend on, and essentially how human health is impacted by human-caused disruptions to ecosystems, right? So if you think about a contagion like COVID or pollutant like air pollution, the interaction between that and the environment influences the emergence of new diseases, or whether we're exposed to it or not. When we think about the human health and the environment, that interaction, whether the environment is sufficiently supportive of health, influences the impact of this contagion on our health, right? And similarly for vulnerability. So I realized that essentially the way that our cities are going is that we're growing cities that are disrupting ecology. So we're pushing the boundaries of human settlements, and we see this increasing interaction with wildlife and therefore lots of increasing zoonotic infections or transmission, like with COVID, right? We're seeing this cities that are dense and with poor housing quality that influence the risk of transmission of disease. Importantly, increased vulnerability to disease. So the environments that people live in, the infrastructure that they're exposed to, and the age they're exposed to. And all these factors are driving inequality. In addition to, on top of being more likely to get ill, you're then less likely to be able to access healthcare. So really, we need to be rethinking health. Why? I think I've made a good case for it, but we can't wait for disease to occur, right? Huge impact on economic development. We can't solely treat ourselves out of any epidemic and by epidemic, I mean both infectious and non-communicable, because we're not talking about the huge non-communicable disease epidemic that we're facing, and really pandemic, to be honest, that we're facing globally at the moment. There is this fallacy, human beings, we tend to discount the future. Like, okay, we have pressing problems now. After we've dealt with these pressing problems, we'll deal with future and we'll prevent. It never happens. Nobody ever prioritizes prevention by choice, right? And we're never done with today. So we have to focus on the future today. And we can't have this siloed approaches, which I've spoken about already. Right, where are we? Okay, got that ready. Oh, okay. So what does this look like if we're trying to rethink health? So if I take a step back and think, well, cities, why do we move to cities? Why do people move to cities? Well, it's employment, it's access to healthcare, it's education, it's better connection to people. But in actual fact, what we end up getting is not so much. So this is my epidemiology brain. So we're not just the buildings behind here, but we see this urban exposures. And these are my 7 S's you can borrow. I started off with sugar, salt, and sports and sleep. And then, I thought, well, everything else has to be an S after that. So it got a bit it got a bit made up after a while. But safe housing, social cohesion, smoking and smoke, which is air pollution, all of these factors are actually what ends up happening when we talk about cities and exposure to cities. And you can see that these all impact on myriad of different conditions. And so when we think about preventing health, it's really important to understand, well, how can these connections be better made, and how can we harness those exposures, not just understanding that these cause this might be detrimental to health, but how can they be harnessed to create health? So instead, we started to redefine and think differently about what a health service is, right? So normally we think about a health service is healthcare. So whether that is prophylaxis, prevention, vaccinations, or treatment or palliation, end of life care. We think about the exposure to that healthcare, how accessible it is, available, etc. And what we're trying to do is control disease, and we look at episodic contact with healthcare and admissions, and ultimately we're trying to impact on mortality and morbidity, which is the burden of disease. But actually, from what I've spoken about before, what if we thought differently about what a health service is? So what if we think about human settlements and the urban planning as a health service? What would that look like? Because we know that, houses that are damp and cold and poorly ventilated, with indoor air pollution or even outdoor pollution, significantly impact your ability to be physically active, your stress, and can exacerbate existing diseases and have these long-term outcomes on health. So why don't we talk about urban planning and housing as a health service? Right? Why don't we talk about transport as a health service, right? Because if you look at the kind of exposures that relate to that, and particularly for transport, waste and food, in the context of planetary health, which I talked about earlier, you can see that it's really not just human health, but they interact to impact on climate change. So we know, for example, that, and it goes both ways, right? So we know how we produce food impacts on our greenhouse emissions, but we also know that air pollution significantly reduces productivity, agricultural productivity, and so food insecurity. So you can start to see, and food insecurity drives malnutrition. So you can start to see how these things are not singular. And it can be overwhelming to think, oh God, where do you start? But it really is an approach to thinking, well, the issue we're trying to address is complex. So the solution has to embrace that complexity. So how can we harness these positive for health, and by whom? This is an example of one of the projects that we've done to do that, right? So, and this is another example of asking questions and following the questions to develop the research. So when one of my several pivots was setting up this research group, the Research Initiative for Cities, Health and Equity. This is when I was in Cape Town. And I didn't really know where to start, right? Because, the conferences I used to go to, my contacts were all kind of HIV TB, and I didn't know where to start. So I thought, let's convene different policymakers that I think are important to health, whether or not they say they are or not. So we ran a workshop. We invited people from the government, the local government around that dealt with housing and transport and education, the mayor's office, health, obviously, public works, and we just to share. I didn't have a question, I didn't have a solution, I didn't have an agenda. Just to say, well, what are your priorities and what you're working on at the moment, and what are the ways in which what you do potentially impacts health? And in the break, because at the time I thought, because of the findings, my earlier findings about the young people and multimorbidity, I was actually trying to bait education, right? So I invited everybody else, but I really wanted to work with education. But in the break, in the coffee break, somebody from Human Settlements, they deal with kind of housing and urban planning, they came up to me and said, we know what we do matters for health. We know that, but it's just not what our priority is, and it's not how we're measured, how our performance is measured. So even though we know what we do matters for health, we're not encouraged to think about health in that way. We just have to build houses and deliver houses. So I said, okay, that's a good place to start. Let's design something together. So we wrote this project together, got some funding to understand, well, how much, what are the opportunities in health policy, in the human settlements policies in the moment, for integrating health? What do people from the human settlements sector think about their role in health, and how can we integrate health into these spaces? So we asked what existing intersectoral policies there are, the opportunities, any barriers and enablers, and how we can collaborate. So this is really a process of kind of learning, relearning and repeating, because I thought I had a plan, but I actually had to kind of relearn it. All of this, before this, I was very quantitatively trained. So my epidemiology is very quantitative. But when I started asking questions, I realized that the methods I needed to answer them were not the methods I was trained in. So I had to train and relearn a little bit, quite a lot actually, more qualitative methods to answer the questions. So I took on quite a lot of training on qualitative methods, on in-depth interviews, which are normally with people in kind of the social sciences and humanities are well versed with. So I had to do a lot of learning to not just say, okay, I don't know how to do this, so let's go back and ask a different question, but saying, okay, if this is a question that we want to answer, how do we answer it? And if I can learn it, I learn it. And if not, who can we bring and collaborate with to make this work? Oops, sorry. Oh, sorry, there's some repetition here. So sorry, I'm just going to go through. So that was one example, right? Another example is the air pollution work, right? So really seeing that as a planetary health emergency, because I realized that in terms of measurement, we can't really impact and address what we don't measure. I realized that across the African region, there is such little monitoring of air pollution, and this, as this statistic here shows. And remember that first urbanization slide I showed you, where it showed how much and the pace of urbanization across the region. So you start to see that this is really a planetary health emergency. When I show this statistic to people, they are blown away that air pollution in the African region kills more people than unsafe water or unsafe sanitation or childhood malnutrition. Just let that sink in, right? And yet we don't necessarily feel the urgency to do something about it. I saw a recent study in Lagos that showed that 60% of deaths on children under 5 can be attributed to air pollution. 60%. How is that not something that we are just not up in arms about? This is a thing. And this is something that bringing it home to where we are now with the pandemic. Sometimes I've noticed that our ability to act depends on how we perceive risk, right? So we're more likely to act when the cause and effect are side by side. So we see, say, with COVID, we know that you're exposed to COVID. On average, 5 days later, you get this. You can get sick with COVID. So we know this cause and effect is side by side. Do we think that if you're exposed to COVID today, and it meant that in 3 years' time, you would get sick with the same mortality, would we have acted so quickly? Is it any less important? Because the mortality would be the same, right? So we tend to not have the sense of urgency when the cause and effect are not side by side, right? When we can carry on as normal, right? So a part of the reason why COVID is so disruptive is because we couldn't carry on as normal, right? Or the consequence can be of it. And this is classic in urban health. So you don't build a house and then your last payment is made when we see that people are not getting, the asthma isn't getting worse because of the damp conditions, right? So the impact on health from those factors and all those other systems are not connected to the activities, and so you can say it's somebody else's problem. And heeding the call to action often requires that the ask is very clear and finite. So we like things like, okay, here's what we do. We lock down for 2 weeks, we're done, and then everything gets better, right? So anything else more complicated, we tend to struggle with. Also, when we don't need to change anything long term, We tend to like that, right? Or when I do something and you can see the way that I've contributed to climate change, then that kind of tends to be more likely to happen. But what happens when we're dealing with these complex issues is often all of these are not the case, right? So the cause and effect don't tend to be side by side. People can kind of carry on as normal and kind of see no evil, hear no evil. We can kind of make it somebody else's problem, even though population health and therefore development is being impacted. And so, oh, somebody wants to interrupt. The meeting is ending. Oh, sorry.
Hi, just wanted to let you know it's going to end in some minutes, so we're going to create another Zoom meeting for the questions and for the end. Is that okay? We're going to send it here.
Okay, how long do I have?
No, now you have like 1 minute, so we're going to create a new one and we're going to send it to all of you.
Okay.
Okay?
Are you just, okay. Do you have, okay, cool. So I'll just wait for you to send it to me.
Yeah.
Okay.
I'm just finishing it right now.
Okay.
Won't be long.
Would you like me to send you mine? Because I have a professional one that wouldn't.
Yeah, that's actually, we don't need it because it's just actually the timing. We thought it was going to be 1 hour, but we can extend it. It has absolutely no problem.
Okay.
Okay.
So will you send it to my email?
Yeah.
Okay, cool.
Do that now.
I'd actually kind of finished, so so we can go into kind of a bit of a chat. Okay, I'll leave here now and go into the other room, yeah? Is that what you'd like me to do?
Yeah, I mean, we could also just wait for it to end here because it's going to end in like 2 minutes. So
2 minutes, okay.
You can just take your time.
Okay, until I get thrown out. Okay. So all of these has really driven this thinking, particularly around the COVID pandemic, is like that we just really need a lot more bolder thinking for bolder action. I wrote this early on in the pandemic, really about July, I say there, about a master plan for planetary health, to say that really we can't use the same logic to protect health for the future that got us here in the first place. How can we use foresight? And again, this learn, relearn, repeat thing I was talking about before, I've had to learn a whole new different kind of methodology around foresight and using those approaches to think about the future. So how can we think across sectors and across geographical boundaries to create health? This is the last slide I wanted to show you, because this is what the COVID systems for health will really look like, right? So if we wanted to address and prevent the COVID, the kind of pandemic like COVID, this is the healthcare system here. And if I showed people this before, they'd been like, oh, but actually, this is the reality of what we've seen, right? We've seen that the sectors that have been needed to activate as part of the COVID response. It wasn't just healthcare, right? It was human settlements, it was transport, it was food, it was energy, it was public, it was private. And you can see why it's important, because this is where we want to get to, but these are the factors that increase the risk of COVID. And these are the different behaviors and exposures that influence those factors. So if we actually want to address that upstream, and stop people falling over into the water, right, from that slide, we need to understand and think differently about the systems. So this is kind of where I am at the moment. This is the kind of research that we're doing. We're just starting to looking for new trouble by trying to now set up research projects that brings together diet and physical activity, but also climate change and urbanization, to understand, well, what are the ways that we can actually support healthy eating in the context of all these urbanization environments, but also how can we do it in a way that mitigates the risk the risk from climate change as well, and are resilient to the events that are getting more frequent because of climate change. So that is kind of where I've ended up now, which, as you can see, is a million miles away from where I started, and I would not have predicted I would have got here, but it really is just the questioning, the pivoting, the failures along the way. So that's where I wanted to stop.
Hi, so it seemed it didn't close, so that's great news. By the way, I also created one, and I just I'm gonna send you now in case it closes.
Mm-hmm.
But I actually just have one question about the coronavirus pandemic. And how do you think it would be like the best way to operate? Like from now on, how do we prevent more zoonotic diseases in a more practical way? Because it's very difficult to do that.
Yeah. So it's questions, right? So we have to ask, well, what got us here in the first place, right? Both in terms of increasing the risk of the disease emerging. So that triangle that I showed with the pathogen and the environment and the host. So that bit of the triangle between the contagion and the environment, right? So what are the factors influencing emergence? So we know that we're encroaching into natural ecosystems in ways that that disrupt the ecology. So across the world, right? So we're not respecting those natural boundaries because we're population growth and we need places to live, but we're doing it in very kind of blunt ways without recognizing that we depend on those ecosystems, and if we disrupt them, not only do we risk this kind of zoonotic infections, but also we disrupt biodiversity, because the zoonotic transmission is a quick, it's a short-term one, the cause and effect side by side. So that triggers, but the other things we're doing, we're disrupting biodiversity, right? We're disrupting all the things that we depend on that will influence our food productivity and things in the long term. We're not worried about that yet for some reason, because we're in the middle of a pandemic now, but we need to be thinking not just what are the implications of what we do for the environment, both for health, both for emergence of disease, both for climate, so we have to be thinking in that joined up way, right? So that's emergence, but also thinking about the risk of the vulnerability to these kind of, to like COVID, for example. So we know, for example, that, I know that no one will ever ask, oh, why are you looking at the infectious and non-communicable after COVID? Because we know that many NCDs increase the risk of COVID, right? So we know obesity, heart disease, lung disease, all increase your risk of getting disease and dying from the disease, right? So when we think about resilience and prevention, we also have to be thinking about reducing vulnerability, right? And so all of these factors that I've been talking about how to get people more environments that are more supportive for healthy eating. It's not just for now, it's not just for obesity, but it's also in the event that we have this emergence, we have a population whose health is more resilient and so less vulnerable. So do you see what I mean? So we have to be thinking in different timelines and also different geographical boundaries, because it's also, when you look at the ways, the kind of impacts that things that we're doing in the natural environment, not only is it disrupting ecology and reducing biodiversity and increasing risk of emergence, the ways that they're happening also increase air pollution. So we have wildfires and burning of forests and trees. Those don't just affect the country it's in, right? Air doesn't kind of get to the border and go, oh, sorry, I don't have a visa, no, I'm not coming across. It goes across, right? So so it's really important that we all have this one ecosystem and this one planet, right? So even if the winds are blowing it away from us, it's short-term thinking to think that's okay, because it's still impacting climate change in the long term. So we need more people like you, who actually, because I think you you lot coming through now as the next generation of scientists, it's not going to be optional complexity, right? Because you're in an increasingly complex world. So embracing complexity, whatever discipline and whatever sector that you end up working in, a key part is going to be how you process and understand complexity, how you understand what you do in the context of a broader system. And that is, I think, is going to be absolutely critical. So if you ask me for my money's worth of where to what to study something with complexity, because you will need it. And it's so much easier to learn when you're younger.
So
Thank you.
there is more one question about from an anonymous that sent epidemiology seem to be the role model for the scientific field, which want to inculcate social studies too. So, how much, in your opinion, has sociology contributed to epidemiology, and do you feel that other scientific fields should also take motivation from this?
So from social responsibility, science for social responsibility was the other question. Absolutely. I mean, I think, one of the things that is encouraging, and it's changing very slowly in the official kind of science systems, but we're getting more and more of these communities. At the London Youth Science Forum last year, I think I showed a slide about some of the lessons. I didn't have time today. I have some slides on lessons I've learned for science from running. That's a different talk for another day. But one of them is finding your community, right? Because they exist. And I am a member of so many communities of scientists that have a commitment to service. So to see science in service of society and see the responsibility, not just both in the what, the why, the how, the who. So the what they do, the why, the people that they kind of work with and kind of mentor, their outreach in understanding that, this world is scuppered if we focus on just us and looking forwards and don't look at the next generation, and don't try and kind of ensure that the next generation of scientists is even more diverse and even more enabled than we were. So one of the things that strikes me whenever I go into one of these communities is it's one of the great things is that you can feel kind of isolated sometimes, because still a lot of the incentives in academia, it's changing a little bit, but they don't really recognize this as important. The number of people that, when we meet at these things, you use your own annual leave and your own holiday to go because you said you were going through this, like, what's this got to do with this? So it's not really viewed as important, right? And so if you're lucky and you work with people like that, then it's great. You realize that it is. But quite a lot of people end up working in spaces where you end up thinking, misfit, right? Am I the only one who thinks this is important? And why? And then you get into the space and you're like, oh my God, there are other people like me who think that, okay, this is something that is absolutely part of our responsibility. So I absolutely think is important. And I think the reason I have hope is not in the system, but in the fact that outside of these formal systems, there's so many of these spaces that are emerging and mushrooming of people connecting to each other. And that's why I said this kind of fairs, and this is why it's so great to have this kind of opportunity. The people you meet in these spaces, it energizes you, right? Because you go back and you think, okay, even if like your teacher is just teaches science like some kind of like, oh, like cramming and no, like, I was taught very old fashioned, like you don't ask questions, like it's just an answer, you just like learn it like this, and you just like, you challenge the questions, and but then you go into this sort of spaces where people are excited and want to think about science that addresses societal issues. These are the spaces that matter. And if you don't find one, create one, right? Because they have to start somewhere.
Thank you so much. And there is more on question about the interdisciplinary subjects and epidemiologies from more one anonymous person. So, how do you think that the field of the epidemiology has collaborated with non-biology centric fields like mathematics and physics in the time of this pandemic?
So that's an interesting question, right? I think there's been quite a lot, but it's one of the interesting things about this pandemic at the moment is everybody knows what an epidemiology is, you know, but at the same time, everyone thinks an epidemiologist is epidemiology is just about mathematical modeling, but I'm not a mathematical modeler and I'm an epidemiologist, right? So it's very much codependent on each other. So I think much more so in this pandemic than others. But I would ask a different question, actually, because one of the things, and certainly we've seen in the UK, one of the limitations of the early advice that we got, it was reminded us that it doesn't matter how brilliant a scientist you are, if you're not in a space with different and complementary disciplines, you don't necessarily ask the right questions or enough questions. So we know, for example, that very early on in the pandemic response in the UK, we had a lot of mathematical modelers on the science advice team. It didn't have any virologists, it didn't have any public health people, it didn't have any social behavioral scientists. And so the questions that were asked and the solutions that were posed were very didactic and singular. And then they started seeing all these unintended consequences. It's like, yes, but if you had spoken to other different types of scientists, you would have looked at the problem from different perspectives, and you would have come up with a different solution. And that has since been rectified, because then now the advisory committee has lots of different subcommittees. You have behavioral, you have vaccinology, you have immunology. So now that's been rectified, but I think it very quickly highlighted the deficiencies when you don't have a multidisciplinary approach to addressing such a complex issue. Because you need economists, because it's not just a health problem, right? Because if you have a problem and you haven't considered what are the economic implications, if you haven't considered the inequality and how that impacts on people who, in a society that's already unequal, so all these different approaches. So I think there has been some, but it's really highlighted very quickly the reason why these disciplines need to speak to each other.
Thank you so much. I think, wait.
Oh, Mario was asking about Complexity, a good book. Oh, there's so many. So, what's it called? The wrong pocket problem. Hold on a second. I'm going to find it for you now. So it's one of the reasons I like this book that I will find now is that what is it? Is that it looks at the different challenges of addressing, what I showed about, Farsighted, that's what it's called. Let me just write it here. It looks at different, some of the challenges of addressing complex issues. So some of what I was talking about, like the disconnect between cause and effect. It talks about things like the wrong pocket problem, where the cost of doing something is borne by the other. So the cost of the healthcare due to the poor exposure is not borne by the person driving the exposure, but by the healthcare system, and how that disconnects. So that's I think quite a good book for understanding the complexity of some of these kind of societal challenges. Zoonotic diseases. I don't have anyone to mind, but there is what's the one, what's his name? Peter. So if you look on, who is this? Juliana, please send me a message on Twitter. I'll connect you to the person. So there's somebody whose name I can't think of right now, who is a really Peter's, I'm connected to him on Twitter. I need to have a look at it. And so it would more be his name. And then if you search his name, because he does a lot of stuff around One Health, around the emergence of zoonotic conditions. So send me a message on Twitter, and then I'll share that with you.
Thank you.
Any final thoughts before I disappear?
Can I ask
Cara? Yeah.
It's actually a curiosity, because you said that we ask questions about the world considering our experiences, and therefore I wanted to know which things from your background inspired you to ask your questions.
Yeah, right. So my background, so I was born in Lagos, Nigeria. Do we have Nigeria in the house? Nigeria in the house? No, okay. Normally we do. There's so many of us. So in hindsight, it's difficult to know how these things work, as they go. But in hindsight, I've only ever lived in big cities, right? And so I think some of these big issues are just been a big part and parcel of my experience, right? So I was born and lived in Lagos in my childhood, and I lived in London, and I lived in Sydney, and I lived in Cape Town. And so it's always been this, and I've been also drawn to the cities, that interaction with the environment as well. So, Cape Town has the mountains, like right in the middle of the city. I visited, the cities that I love the most are the cities where that kind of nature and cities are kind of like, Hong Kong is like, you're in the middle of the city and you go up a little bit and you're running in the mountain, or Rio, that is also right there, or so those kind of cities. So I think maybe that experience in hindsight, and also just the uncertainty, right? So I think there's things that I realized growing up that I've only realized now that were not normal, right? So navigating uncertainty, and I was speaking to somebody in Lagos the other day, and they reminded me, because I said, how's things going with the pandemic? She's like, yeah, I saw someone the other day, and then we started talking about that time with that pandemic, because it's just one of the uncertainties, right? So people are navigating all these uncertainties, and it never really occurred to me that, perhaps I've had, by not, maybe a bit more resilient than if I'd grown up in a space where everything was clear. So a lot of the uncertainties that I just internalized growing up, I've only very recently realized that, oh, this wasn't normal. Didn't you also grow up with not knowing if you would get to school because there's a coup going on, or because there was so, but it didn't scar me, I don't think. But I think maybe some of those things are, and to be honest, it took me a long time to express that curiosity, because, the education I had very good education, both in Nigeria and the UK, but it was very, very didactic, the old school of like, you just sit and then you just take notes, and then you cram what you've written, right? And I remember the first time, and medicine is the same to a large extent, right? You just learn all the things that we already know. And one of the things that got me really excited the first time I struggled with academics was when I was doing that international health VSE, because there was suddenly no answers, right? And then and I remember being in a small group, and then the teacher was like, well, what do you think? I'm like, what do you mean, what do I think? What's the answer? Like, I don't remember reading this. And then it helped me express and connect to that lived experience, right? And to start asking questions. And I really struggled, I have to say, like, I really struggled to express and find my voice, because my intelligence was always pegged on what I could remember and how I could understand things, right? And so suddenly the intelligence was pegged on how you express what you think. And I was just like, but that experience was, and writing and connecting that to writing, you know, that was the first time I had to kind of write in that way, you know, and that really, I think that helped me connect to that lived experience. And that's why I'm expressing it now, because it's not very clear. And you can go through science and no one can, because we say science is objective. It's like, no, science is not objective. Science is a rigorous methodology for applying very subjective experiences to understand the world around us. So it's not, you know, even when you write in science, we encourage you never say, I did this, or it was like, this was done, or you remove yourself from it. And that's still the very traditional way of doing science. You remove yourself. Whereas the good science and the questions, the good questions asked when you insert yourself. It doesn't bias science, it actually makes you ask different questions. And when you do, you'll be surprised. You'll ask a question that you think is really obvious, and somebody else who doesn't have your experience is like, oh, that's a good question. And you're like, is it? I just thought it was a stupid question, but you have a perspective that people don't have. So it's been a journey, I think, to get there, is my point.
Hi, Tolullah. I have a question. My name is Maria Fernanda from Brazil too.
Of course.
And I would like I would like to ask if you believe that the COVID-19 pandemic will effectively change the way we are thinking the development of cities today.
Ooh, that is the question that everybody is talking about. You know, honestly, I'm in like a webinar a week at the moment on this topic. And I can point you to, let me point you to a recording of a seminar that that we ran on this. If you just give me 2 seconds, because I organized this seminar on building healthy, sustainable cities in the era of COVID, right? It's such a good question. The answer is complicated from my perspective. I think it's important to recognize that there's nothing inevitable about learning from experience. That's the one thing history has taught us. Just because it's disruptive and it's such a big thing does not mean we will learn anything, right? So that's the first thing. That said, the reason I say that is just to highlight that we have to be intentional and we have to be deliberate about learning, right? And really be prepared to ask uncomfortable questions like, why have we developed cities that are not for the majority of people to start off with? Who is gaining? Who stands to lose, right? If we decide that we want to have cities that are accessible for the most people, because there are trade-offs to be had there. Who is planning? Are we building cities for 5 years' time for the next election? Or are we building cities for long-term population health? So this question is exactly why, if you look at that link I sent you, there's a few more resources in there. They're written around thinking about planetary health. There's the piece there on the Marshall Plan. That's exactly, your question is exactly why I wrote that piece about Marshall Plan, or the Marshall Plan, because we actually have to say, we want a Marshall Plan for planetary health in Africa. What will that look like? What does that mean? And how does that change how does that differ from what we do now? So the right conversations are being had at the moment, and that's really encouraging, right? A lot of the people that are on the table talking about health is really encouraging. You know, like before, just 5 years ago, trying to organize that workshop I talked about and trying to get people to come to me like, no, we don't do health. And I had to convince somebody working in housing why they did health, or something to educate. You know, now you talk about post-COVID development, no one's saying, oh no, we don't do health. Is anyone saying COVID is not my business because I don't do health? No, because suddenly it's a really good exemplar of a cross-societal challenge. But in reality, actually, all health is cross society. So the right conversations are being had really across the board. So that's really encouraging. And they've been had at different levels. The key questions will then be, moving from a conversation to action, will then be the drivers, right? So it tends to be money. So what is driving, what are the financial incentives around going towards sustainability? So there's some really interesting innovations, for example, from a sustainability and green perspective, around how you make green recovery and healthy recovery more, how you incentivize that, right? And how you get people in that webinar I had, you know, we had a session on financing. What do I know about financing? You know, I've written a piece on impact investment for government. What do I know about that? But I know that, you know, these are the spaces that, these are the conversations we need to start having. Otherwise, we talk and talk and talk, and the people who are actually funding the cities and funding the development are just continuing to do their own things. So I think it's really encouraging that those different actors that are normally siloed and separate have started having a conversation. So that's a really good start. Let's see where we go. It's kind of important that we just keep up the momentum, and that's driving a lot of the work that I do. That website that I shared with you, that it's an initiative that I started because I realized that actually I need to have a platform of having science-based solutions that are kind of into practice and not just sitting within academia, because I felt like there's some things that I do that are not strictly academia, even though that's kind of my full-time job, but I do other things as well. And so this is really saying like, okay, if I want my science to be most impactful, I really need to create a space. And I couldn't find that space, so I created it to do that. It was for the African region. So that's the kind of work going on. There's a few resources there that you can tap into. And by the way, certainly for those in, if you want to stay in touch, then just go to the Urban Better page, and there's a join us there, and you can kind of connect. And it's still a work in progress because I'm doing this, you know, on extra time. But that's a way of kind of connecting and finding out about this kind of work. But great question.
Thank you. I also would like to thank you. You can, okay, sorry.
I was just gonna ask, what was the name again? It was Urban, or the site, it was Urban something?
I'm just gonna Urban Better. I'll just send it to you now. Urban Better, there you go. It's in the chat. Great. Okay. I think I've taken far too much of your time.
So I have more one question.
Okay.
No,
Last question.
Sorry.
No.
No, it's my personal question. So part of my family is Black, and unfortunately, the segregation is completely related about the skin color in my country, and because of that, many of them don't have access to study. You are an inspiration for my family, especially to my little sister. And I would like to ask you if you not see racism in your journey, and how do you deal with this?
Yeah, so it is such an important question because that is a reality, and it's, you know, across the world. It's probably one of the most stupid pan global traits of humanity, right? The ways that I've experienced it along the way, and this fits in along that. I didn't put that on that timeline. But you quickly realize that there is, you know, sometimes the word ambition is weaponized against you. Like, it's like, oh, you're a bit ambitious. you know, I was like, I grew up thinking ambitious was a gut, so your parents told you to be ambitious, right? Like, and then you realize that by that people mean, oh, isn't this more than you can do? Like, this is not like what, you know, it's a good idea, but maybe not you, you know? And it took a while to realize that, okay, you're weaponizing that word, right? Ambition, when they say, oh, she's a bit ambitious, it's not actually a good thing. It's like, okay. I remember, you know what, the multiple failures I was talking about with the TB diabetes, the first failure, first failure, they just said it was a stupid idea, blah, blah, blah. But one of the other failures, when the idea was, because in the interim, a couple of years later, the landscape changed and people started talking about TB diabetes, right? So I applied again. And then I got feedback that said, this is clearly written by a supervisor. Even though my supervisor was an HIV and an immunologist, and I was writing about TB and diabetes and public health. What does that mean? Right? That you couldn't possibly have written it. So it's just that benefit of the doubt. Last week, I don't know time. We had a webinar on, there was a would have been in Berlin, Falling Walls webinar on systemic racism and discrimination in science. I'm going to, I don't know, maybe if you Google it, maybe the link comes up. There is a YouTube link to the session. I don't know. Have a look at it. So this was the session. I don't know if you can find the recording. Then you can listen to it, because we have this really interesting conversation about all the critical barriers that are embedded in science, right? And I spoke a little bit about some of this around that kind of weaponizing ambition of people not giving you the benefit of the doubt. Like, you have a new idea, but it's like, but can you do it? Whereas if you look differently, like, oh, this new idea, I'm sure you'll be able to. So this is some of the things that I kind of had to deal with along the way. And one of the interesting things, you won't see it in the video. If you don't find the video, by the way, just send me a message on Twitter, and I've got it in somewhere. It's on YouTube, the recording. But at the start, it's not on the YouTube session, because I said it, but at the start of the session, right? So this session is called Combating Systemic Discrimination in Science. At the start of the session, there was a 1-minute video that was played about Falling Walls, the conference, blah, blah, blah. Obviously, it's normally in persons, and it's a big conference. It's like thousands of people. So in the images, it was like, you know, the audience, the speakers, interactions, all of that. So there was like hundreds of people showed. There was like maybe one non-white male shown in that entire video that was played before the Combating Systemic Racism in Science. So I was like, okay, we're talking about this, but did anyone notice at the beginning of of this video that everybody was a white man, kind of around 40 and up, in a tie and a jacket? Like, it was a sea of white men. And I was like, come on, like, how do you not see that? How do you not see that that is a microaggression, that people watching, this is a public thing that anybody can watch, that your younger sister could have tuned in to watch it and it's like, oh, that's what successful scientists look like. You know, how do you not see that? So we have to be calling this out whenever we see it. And I think in a different year, that may not have gone down well, but I think there's been maybe a more public, especially with the Black Lives Matter and SARS in Nigeria, etc. There's a more public kind of confrontation of this societal discriminations. But we're confronting that in the UK as well. You know, like, we're seeing that ethnicity is a huge risk factor, right, in terms of COVID outcomes. So even after you take away whether you're poor or not, where you live, where you work, still minority ethnic groups in the UK are more disadvantaged. And that is just a societal discrimination, right? That they have to address. It's difficult to measure, to point out, and it's really uncomfortable. But it just starts with certainly people in positions that are able to calling it out. So the conversations are happening, and I hope that you and your younger sister are seeing at least increasingly different types of people in science, and not just the old-fashioned. So, you know, baby steps.
So thank you so much, more on time. And I would like to ask for Juliana or Clara, please take a screenshot of the lecture. And please, everyone, turn on your camera.
Can you do it? Because I don't know how to take a screenshot on the computer.
Yeah, I'll do it.
Sorry.
You can turn on your cameras, please, if you don't mind. You can have a picture of all of us here.
Yeah, all the people hiding.
Yes.
You see, was there. You've been quiet.
I think we're ready. Just let me see. I can see everyone. Wait a second.
Are you going to count us down, or are you just going to sneak in us whilst we're making funny faces?
Yeah, she'll count down.
Okay, 1, 2, 3. I think it worked.
Okay.
Let me just do one. There we go. Okay, 1, 2, 3. There we go. Cool. Well, it was a pleasure. I wish you all the best. Twitter, as knows, I'm not very good on email, so don't try email really. But you can DM me on Twitter. Is the best way to find me. If you have any other questions, any other, just any random questions or ideas on thoughts that you have or readings or whatever, please don't hesitate to contact me. I have a whole other talk that I give on why stalking is so important in science, and learning to be a really good stalker is really critical to being a successful scientist, because if you find somebody who is interesting and who you're interested in, really reach out and connect with them, because the other aspect of serendipity and atypical opportunities that I didn't mention is that is the amount of stalking I've done. Like I told you about French Guiana, that was only one of them. When I found things that were interesting, I looked up people's affiliations on papers that I liked, and I found their email from the journal, and I sent them an email, and one of them I'm now working with 10 years later. So really reach out. When I say get in touch, I really mean it. And not just for me, but as you go on in your career, reach out to people who you find that are interesting, because you never know where that will take you.
So thank you so much. I certainly can do here more to 2, 3, 4 hours. Just listen you. You are really wonderful. And thank you for accepting this inviting. And I am really glad.
Thank you. Thank you for the invitation. I'm very excited about the future. Thank you. Bye, everyone.
Bye.
Bye, thanks.
Amiga, terminei. Graças a Deus. O dia de hoje, no caso. Mas eu venho aqui só na quinta.